We all carry an invisible backpack. Now that backpack may be big or small, maybe for the young or for the old. We can carry it on long journeys or just for the walk back home. But what's important is what's inside our book bags, as many people don't realize that the items that are inside our book bags are the same across the board. And that, let's just say, for the sake of this talk, that the items that are in our backpacks are ones that impact our health. So what are these items and how do they impact our health? Well, their education, our neighborhoods, our income levels, our health care, and basically social impact. Now, I said that all of us have the same book bags, right? In that the items in our book bag impact our health. And if we all have the same backpacks and they impact our health, then that should mean that our health outcomes should be all the same, right? Well, we know that's not true. And in fact, if we look at the early days of the pandemic, we realized that Black and Hispanic communities were 2 times more likely to be affected by the virus than white communities when we're looking at New York City. We also realized that Black mothers were 3 to 4 times more likely to experience pregnancy-related death outcomes. And we also realized that if we look at our American Indians and Alaskan Native families, that their life expectancy is 5 times less than anybody else in the nation. So just looking at those facts alone, we know that our health outcomes are not the same. So even though we have the same backpacks and the same items in our backpacks, our health levels, they're just not the same. So there must be another factor at play. So just because the items that we have in our backpack, which we'll call our social determinants of health, and our health outcomes that we're seeing, health disparities, there must be something that's taking place that we're not addressing here. So what if I tell you, why don't we change the color of our backpacks? How does the color of one's backpack look when we're looking at social determinants of health? Well, we notice that there's a difference. We notice that educational attainment is different. We notice that our neighborhoods no longer look the same. We notice that there's a disparity in the income that we have. And we notice that our community and social impact vary. And we also know, lastly, that the access to healthcare is very different. So suddenly, we're seeing that the color of one's skin varies differently. And okay, let's take a step back. Someone might ask me, okay, Faith, well, are you saying that race impacts the quality of your health and the quality of your social determinants of health? Well, yes and no. You know, race does have a factor on the quality of your health, but it's not race alone. It's how someone perceives your race. It's how someone adds value or worth to your race that makes them want to either treat you well or mistreat you well. Something that we call racism. Okay, so you're telling me that the act of racism is impacting my health? And yes, it is. And in fact, in 2019, the American Academy of Pediatrics actually came out with a statement saying that racism is a core determinant of your health. That we're seeing that among children, that racism is driving the health disparities that we're seeing. Well, if we know it's affecting the kiddos, then it has to be affecting the adults too. That health disparities are connected to racism. In fact, this is something that we know is not new in medicine. We knew that health disparities have always been there and that they're affecting different populations. But one thing that we did know that was different, that Dr. Fauci mentioned in a White House press conference at the beginning of the pandemic, that although health disparities has always been the status quo in medicine, that does not make them acceptable. That doesn't make them okay. And why are we okay with them being the status quo? And I agree with Dr. Fauci. You know, there have been decades upon decades of research written by people of color who are scholars, showing the clear connection between racism and health disparities. So knowing that racism is a core determinant of health, and knowing that it impacts and it causes us to have the health disparities that we're seeing, we can't just sit there. I mean, the research has been there for decades, right? It's nothing new. So that means we must acknowledge it. We must make statements out there to make sure that people understand that racism is a public health issue. And someone like me, I'm that type of person that's not just going to sit there. I'm one that's going to be out there and being the one that wants to make the statement. So my friends and I, a group of medical students across the country, did just that. And it worked. We were able to get an organization that had barred Black physicians previously and apologized for in 2008 from being members of their organization. We got this organization that previously only had 2 policies out of thousands that mention the word racism to now adopt this policy. And at that point, we're feeling like, yes, we took down racism in medicine, we cured it, we changed it, but then we suddenly realized that nothing had changed. The status quo in medicine was still the same. We realized that, even though such a big organization that impacts healthcare made this statement, the daily lives of the people that are impacted by this did not change. We realized that medicine needed something more. Because even though the AMA had made this statement, about 145 counties across America had already made a statement saying that racism was a public health issue. And that's when I realized that statements alone will not help us build and maintain stability in order to foster a community that will combat racism. Instead, we have to find ways in which we can build a mindset of sustainability. And in order to do that, we have to look at how we are viewing the healthcare system. So last year, my grandfather came down with COVID pneumonia. And though my grandfather was really knowledgeable about the healthcare system, he worked as a social worker, hospital administrator, and as a chaplain, he still became susceptible to the disease and still was not able to obtain the quality health care he needed. To the system, he was invisible. And as someone who was in healthcare, I advocated for my grandfather. I was there. I talked with his medical team. I made it clear the minute he was admitted to the hospital that he needed ICU level care. However, I was denied 3 times by his medical team. They felt that my 84-year-old grandfather would be able to do well on a regular hospital floor, even though his oxygen levels were barely above 90 on 40 liters of oxygen per minute. They felt that he would do fine. It wasn't until one night when his oxygen levels went down to 70 that they realized he probably does need ICU care. But at that point, it was too late. And within 5 days, he passed away from COVID. Now this story is similar and more seldom seen in Black and brown communities. That though we do have the medical knowledge, we do have the access to healthcare, and we do have family advocates, or we self-advocate, that we were still dying from COVID. And no one seemed to care. So at this point, we're wondering, what do we do? How do we build a mindset of sustainability? And we have to look at healthcare again. As a medical resident, I am still an optimist and believe that we can change how we're seeing medicine. I believe that we can build a mindset of sustainability. And there are some ways I think we can do this as. As I travel from coast to coast, looking at programs and trying to figure out as a new doctor where I should go, I realize there's certain language that people use to describe their patient population. I realize certain programs who use words like non-compliant, difficult, low income, not really engage with the healthcare system were programs that didn't really have good health outcomes in community with their patient population. But when I went to programs that looked at their patient population, their Black and brown patient population, and described them with words of diverse, goal-oriented, resilient, very engaged with the system, their healthcare outcomes were a lot better. And that's when I realized the language that we use to talk about our patients matter. And someone can say to me, okay, Faith, language, yeah, that's easy. Anybody can act like they care. They can use those words. That doesn't mean that they mean it. But I said, okay, well, I didn't just stop there. When I was at these institutions, I also asked, how do you value the people that work at your institution already, that are part of the Black, Indigenous, or people of color community? How do they feel working at your institution? Do they feel when there was acts of racism or discrimination supported? Did you only put out fancy statements or create committees on diversity and inclusion retroactively after something happened? Did you promote them to positions that were high within your institutions, but not provide the resources they need in order to be able to handle their job? And if you asked them to be on those diversity and inclusion panels, did you make sure that they were adequately compensated? What I was asking for is basically, how did you value the Black and brown people that you work with in an everyday life? Because it's okay to put out fancy statements and say that racism is an issue, discrimination is bad and stuff, but if you are not caring and being compassionate for the Black and brown people you see every day in real life, that statement means nothing. Now someone will say, okay, Faith, your language makes sense, I'll change my language, treat the Black and brown people I see in an everyday life well. That's fine. But you lied to me in terms of, will this take time, will this take money? And I'm like, yes, maybe in that aspect it will, but going back in history, I realized it really doesn't, because I've seen this actually happen. So way back in the day, there was a Black physician who wanted to create a hospital within a community a lot of people were just not really for. But he realized that the soul community is one that would value the hospital. So he went to the Black ministers, Black physicians, the Black businessmen, and asked for their support. But it wasn't until he included the Black clubsmen of the area who looked for the supplies, the money here and there, that he realized the community will build this hospital. And within 5 months, this hospital, Providence Hospital, was able to be open for this community. And we realized that this hospital, 2 years later, that the Black physician that wanted to build it, Dr. Daniel Held Williams, was able to perform the first successful open heart surgery in this hospital. When you value a community and when you put them at the forefront of your work, the quality of your healthcare changes. We realize that when you center a community and you talk about it positively using good language, health changes. It's not statements about racism that will change how medicine is. It's how we use the language about our patient population, how you treat your BIPOC colleagues, and how we value the community that we serve that will move medicine. That will allow us to combat racism. Thank you.